hand over to Hannah, who's just going to start us off.
Hello, my name is Hannah Morland-Jones and I am the peer lead and recovery college manager. I've got lived experience myself of a number of diagnoses using services and also experience as a peer support worker and somebody who has coordinated and developed peer support services. Today, myself and a few of my colleagues are going to just talk for a very brief amount of time about our experiences developing with a host of other people, some of whom are here today as well, a little bit about developing the Recovery and Wellbeing College. We hope to be able to cover a little bit today for you to be able to learn a little bit more about our journey and who we are. But if anybody has any questions afterwards, it would be really great if you could, get in contact with the college. We'll be happy to speak further because I'm mindful we don't have very much time today. I'll just pass to Georgia to introduce herself.
Hi everyone, so my name's Georgia. I'm the one of the deputy peer lead trainers at the Recovery College, and I'll hand over to Susie.
There, can you hear me okay now?
Yes, I can now.
Yeah, great. Sorry about that. I'm Susie Boxall and I've just been employed by the Recovery and Wellbeing College as the deputy peer lead. And like Hannah, I've had a lot of mental health challenges myself and I've been a user of services, and I'm able to use my own lived experience in co-developing and co-delivering courses within the Recovery and Wellbeing College.
Kate, I don't know if you're happy to introduce yourself.
Yeah, hi everyone, my name's Kate and I'm the curriculum lead in the Recovery College, and my background is being an occupational therapist in various settings across Cardiff and the Vale, but with the college for a couple of years now. I will hand back to, is it Georgia?
Yes, sorry, I can't see anybody, so I'm a bit kind of like, don't know what's happening. But yes, I'll start us off. Thank you very much. So what problem are we seeking to solve here at the Recovery College? So we seek to transform the whole system power imbalance at the heart of health services, which may harm those it seeks to help. And we recognise and value the lived experience as a profound source of knowledge to empower our communities to improve the health and well-being of Wales.
Okay, so I'm just going to talk a little bit more about what is a Recovery College. Some of you may be familiar, some of you may not, but all our courses are co-designed and co-produced, and we're the only mental health services in Wales that do this. So just to talk a bit more about that, so when we start to develop a course, we get the practitioner and the peer together, and it's very much a mutual system whereby we each input and then develop the courses. Peer support is at the heart of everything we do, and we recognise the value of that in terms of learning from one another, and the reciprocity of that is at the heart of what we do in all aspects of the college. So we believe that recovery is a personal journey, and we are guided by the recovery principles of hope. So everyone is different. We all have been on our own journeys, but I think hope is a really important guiding principle, because facilitating the courses, which I do one of the courses, and when people can hear about somebody else's recovery, wherever they're at, it can inspire that hope to see that people do get better, learn to live with their mental health challenges. Control, so people get a little bit more control over their lives when they're empowered to manage their own mental health. And opportunities, so a lot of the courses we run give people a lot of opportunities to develop their own recovery. So our courses are educational rather than therapeutic, and they're not designed to replace services. We always make that very clear at the start of our educational courses. And our students, we have a mix of students. We have service users, staff and carers. So in any given course, we're going to have a mix of an audience. And that's really where we believe that we're all equal. There's nobody coming into our courses, there's no hierarchy. And we're always really keen to get everybody's views and feedback. And the co-production process is literally at the heart of everything we do in terms of developing our courses, developing the business plan and looking at the future of the college. I'll hand over to, is it Kate now?
Yeah, thank you, Susie. So just to give you an idea of kind of the timeline of getting to where we are today within the Recovery College. So in the initial stages, we had a steering group who worked really hard to kind of get the college going and keep that momentum up, and that involved service user representatives, carers representatives, members from third sector, and health staff as well within that steering group. We were then fortunate to have some commissioning from IMROC to support with kind of those foundations in establishing the Recovery College before the staff team came into place. So there was a number of sessions where IMROC provided consultation in kind of mapping out the service and looking at the future of the Recovery College. And then in April 2020, Hannah, our peer lead, was appointed into her post. And that whole process was co-produced with the interviews, and the decision around appointing the peer lead was co-produced. This then led to, in June, some of the members of the steering group then formed a consultation group to set the priorities for our first course within the college. And this was a sleep course. So that was then piloted in the summer of 2020. And just before that, I came into post as occupational therapist after about a year of attending the steering group meetings and a delay because of redeployment, but I made it into my post in about July time. And then over the summer, we worked on implementing the structures and co-creating courses ahead of our first term in autumn 2020. And we had that initial pilot of that sleep course, like I said. And then we reached September 2020, where we were able to officially launch the Recovery and Wellbeing College with our first full term of courses in the autumn term. And that was an online launch because of the circumstances in the pandemic. But that was the kind of, the moment that we were able to then kick off and welcome students into our courses. I'll now pass to Hannah.
So I think it's really important to be very clear that co-production in the college goes far beyond the design and delivery of courses between those with lived experience and maybe practitioner expertise. When we say that we are the first co-produced mental health service in Wales, we're talking about co-production which goes far beyond our staff team. Many of the people here today have been involved in co-producing the design of our service. We co-produce with our students and stakeholders. We co-produce designing and branding. We co-produce our curriculum direction and our priorities. Our priorities aren't led by health priorities or targets. They're really led by our students, and more we see the value of embedding additional co-production. We're lucky enough to have had Alex Congreve as one who came to us as a student representative, who's really supported us in moving forward in developing more and more co-production within the Recovery College. I think she's been speaking over the course of this conference as well. So that's been a real benefit to us. And we've also had another student representative, Katherine, and Katherine and Alex really shaped a lot of important developments, including opportunities for co-evaluation. So we have regular informal student budball sessions, which are facilitated by our student representatives. And they are really an open space where people can tell us, some of their really open reflections about the college, their own priorities with no set agenda. I think that's really important. And I suppose we also have our open forum events, which I'd really recommend anybody coming to if they want to get a bit of a sense of the college and who we are and the college community. And there's also an element of co-evaluation at the open forum. So any of our students are welcome at any point to share something about their experiences in the college. Sometimes that will take the form of a poem, it might be a work of art, it could be some dialogue, and those contributions are valued and shape our developments. And I think that's really important, because a lot of the time, I think sometimes co-production is seen as an opportunity to give people a voice, but then what happens next, and what exactly does that inform? When we've been looking at our strategic plans and developing a business plan for the college, then we have decided that we very much want to co-produce that with our students as well. And I think that's incredibly important as well. We're working with Daniel Marsh and Alex Congreve on finding opportunities for co-production within the business plan. And Daniel said he thinks it's probably the first co-produced business plan that he'll be handing in on his graduate management scheme. And we really, we don't always get it right. We're learning all the time, but I think co-production is really what makes us unique, and it's such a benefit to us. We also have a large board in the college, so any decision that's made in the college, myself as college manager will bring that to the board for ratification. On our board sit people who reflect all areas of our community in Cardiff and the Vale. They might be people with a lived experience, people from third sector, staff members, and more we want to dedicate more and more time to this, because we realise how it benefits us really, and also just how important it is. And then I suppose moving on, we've got a short film, is that correct, Georgia? And this is a conversation between myself, peer lead, Georgia, who is one of our deputy peer leads, and Andrew Vidgen, who is our governance lead in the college. And Andrew, I think, has been part of the journey for a long time in terms of development of the college, and we're just having a bit of a conversation about what co-production means to us.
So we were talking about co-production, weren't we, and what it means within the college, and why we think it's a kind of central principle and something that should run through all aspects of the work of the college, and how that might be understood, how it might or might not be understood by people who don't kind of understand the work of the college. Was that a good summary?
Yeah, definitely. And I liked what you were saying before in terms of it's that mutual agreement. Is this co-produced? Is this co-production? That kind of, does this feel co-produced to you? I'm feeling it, but the other person may not. And I think that actually is something I haven't really considered, that it's not just about we are both doing this together. It's, do we feel like we're doing this together? Do we feel that there's mutual learning, that there is that kind of co-production that is happening for both parties? Or multiple parties. It doesn't necessarily have to be just two individuals doing something.
Yeah, and you're making me think about how you work that out really when you're working with someone. So I was trying to explain to someone earlier about why it's good that Nick and I developed a course together from scratch, and why is it important to start with, almost bringing a blank sheet of paper, because it puts you on an even footing to begin with, and it might be different. Your feet might be higher in some ways to the other person, but there's a kind of acknowledgement, or there's a commitment to start this, whatever this piece of work is, this process, on an equal footing. And the symbolism of starting with a blank sheet of paper is the start. And that being open to learning, so being open to learning from the other person. So I learn from Nick, he hopefully learns from me, but we learn from each other. I mean, I guess that's co-production in a educational context, isn't it? So, within the frame of the college.
Yeah, that makes sense to me. And I think if I'm thinking about where co-production comes in outside of the courses and outside of the educational context, then I think that also you can use that blank page analogy as well, where I feel a lot of the time within health services, an idea is formulated between clinical staff, and then they take it to the community or the group of people that they want to help and ask people, is this okay? Or this is what we've designed together. What do you think? What are your comments? And those comments may or may not affect any change. And I think what we're working towards in the college is also that blank page approach in terms of service design, so that when we're thinking about every aspect of the college, be it our priorities for curriculum or other aspects, that we can create opportunities to sit down with our students and stakeholders and maybe people who aren't currently using the college as well, and really explore what are their priorities. Because I think within the college it's been a bit of a process from the beginning, and nearer the beginning of our development, I think although we were peers and professionals, we were very much had our own ideas about what might be good to add to our curriculum or how we might want to develop the service. And I think more and more we've seen the benefit of actually starting from a blank page. And I suppose one example of this is when we were looking at course design, and we thought we really want to understand what our students think about our course design and our branding. And so we took the course materials that we had and we had a consultation, and we asked our students, what do you think about how we're presenting this? And then they fed back to us, and that was more of a consultation, and we took that kind of approach. But what we really learned from that was that when we were developing a branding, and I know, Georgia, this is something that you did and you worked on, we had a meeting with our students and some of our students who had nominated themselves to say they'd like to become more involved as consultants, to work with Georgia to talk about what might be important. And so important areas were, for example, that we didn't use cartoony images, because actually the majority of students found them patronising. Other aspects were about courses being presented more professionally in terms of the materials and the branding, which we wouldn't have necessarily thought for ourselves wasn't that important, but that came through as really important. And Georgia went away from that, and although she didn't design the entire branding, sat down with our students, it affected the design, didn't it, Georgia? I don't know if you've got anything more to say about that. And I think that made our branding so much better than if we had just done that away from our students.
Yeah, definitely. And I think from the back of, you know,
and that was more of a consultation, and we took that kind of students found them patronising, other aspects, and although she didn't design the entire branding, sat down with our students, it affected the design, didn't it, Georgia? I don't know if you've got anything more to say about that. And I think that made our branding so much better than if we had just done that away from our students.
Yeah, definitely. And I think from the back of, you know, for being a part of the consultation, you really get an understanding of why certain things are important, why certain things are less important. And that's the true value, I think, in it as well, is that you learn how it's being perceived, because, you know, what I like, you may not like. I may want the colour purple, but purple may, you know, so all of these kind of different rich discussions came from it, and understanding around how actually it was very important to the students that the branding was consistent and that the presentations were consistent, because that made them feel, I think there was a safety, there was a trust, and there was a comfort with that. They're just kind of words I've kind of picked at random, but I know that it was kind of like, we know this, we'll understand that this is a recovery college, we know what to expect, we know the flow of it. So without talking about that for too long, it isn't about what I think is a good branding or a good template. It's about what is the best for our students, what is best for those that are going to be viewing this and seeing this and accessing these courses, and how best to kind of do that for them.
You're making me think about lots of things. You're making me think about the very start of developing the college, and that kind of idea that a number of things come together, and there's a sweet spot between kind of peer work, you know, the value of peer work, educational element, and co-production. And the college, you know, those three intersecting circles, that's the transformational bit, is that is trying to do things differently. So not trying to transform in the same way, but trying to transform in a different. So that, you know, I think that's really important, that commitment and honouring there's a few things. One of them is about honouring the people that you're trying to offer a service to, and I mean service in its kind of broadest sense, but also I think we are having this conversation because we think it's a better way of doing things. That, well, it's more than better, it's like it adds so much richness to and opportunities to experience that when you're working in a co-productive way, because it's more joining. It's more joining with the people that you're with, and that might be, you know, your colleagues, might be students. It's a more enriching way of working, and I think that's partly why we're having this conversation, because we're have experienced, not just understand the word co-production, but you've experienced what the value might be.